You know that feeling? When you're faced with some medical information, maybe about your pet, and it just feels like this huge wall of jargon.
Absolutely. It can be totally overwhelming.
Well, today we're tackling one of those topics. We're going deep on something called extrahepatic biliary obstruction, EHBO for short.
That's right. And we've gathered quite a bit of info, veterinary overviews, treatment stuff, diagnostic advances, even some pointers relevant for the naval exam vets take.
Yeah, the idea is to piece it all together for you so you get a solid grasp without getting lost in the weeds.
Exactly. Our mission, if you will, is to make sense of EHBO, what it is, what causes it in pets, how vets figure it out, and, what can be done about it, aiming for clarity.
Okay, let's start at the beginning. Bile. What is it, really, and why is it so important?
Okay, bile. Think of it like a super specialized detergent made by the liver.
A detergent.
Yeah,
Okay.
it gets stored in the gallbladder, waiting. Then, when your dog or cat eats fatty food, the gallbladder squeezes, sends bile down into the small intestine.
And that's where the magic happens.
Pretty much. It breaks down fats so that they can be absorbed, crucial stuff. And it also carries away waste products, particularly bilirubin.
Bilirubin. That's related to red blood cells, right?
Exactly. It's like the leftover pigment when old red blood cells get broken down. Bile helps escort it out of the body.
So, EHBO. That means this whole process gets jammed up, the drains are clogged.
Precisely. Extrahepatic means outside the liver. So the blockage is in those main pipes, the bigger bile ducts, after the bile has left the liver itself.
Okay. And when that happens?
Well, the bile can't get out, so bilirubin starts building up in the blood. That's what causes jaundice, that yellow look.
Oh, okay.
And without bile in the gut, fat digestion goes haywire, and those waste products just accumulate. Not good.
Right. So what actually causes these blockages? What kind of things are we talking about?
We can kind of split them into two big buckets. Benign, meaning non-cancerous, and malignant, which is cancer-related.
Okay, let's start with benign. What falls in there?
Well, you've got gallstones, for one. Little hard stones blocking the ducts.
Like people get...
Yep. Then there are strictures, narrowed areas, maybe from old inflammation or surgery. Also, something called primary sclerosing cholangitis, where the ducts get inflamed and scarred up. And believe it or not, parasites. Certain worms can physically block the ducts.
Wow, parasites too. Is that common?
Not the most common cause, but definitely something vets keep in mind, especially depending on the region or the animal's history. It happens.
Okay. And the malignant side, the cancers.
Right. That includes cholangiocarcinoma, which is cancer of the bile ducts themselves.
Okay.
Or it could be pancreatic cancer, specifically in the head of the pancreas, pressing on the bile duct.
Because they're so close together anatomically.
Exactly. And there's also ampullary carcinoma cancer, right where the bile duct and pancreatic duct meet before entering the intestine.
Got it. Now, you mentioned this happens in pets too, dogs and cats. Are the causes pretty much the same, or are there pet-specific issues?
There's definitely overlap, but yes, some key differences. In dogs, we often see EHBO linked with pancreatitis inflammation of the pancreas or cholecystitis, which is gallbladder inflammation.
Okay.
And a big one in dogs is gallbladder mucosal. That's where the gallbladder fills up with this thick, sludgy mucus. It can cause a blockage or even rupture.
Yikes. And cats?
Cats are interesting. EHBO is often part of what vets call triaditis.
Triaditis, three things.
Yep. Inflammation of the bile ducts, cholangitis, inflammation of the pancreas, pancreatitis, and inflammatory bowel disease, all happening together. It's like a troublesome trio.
Huh. So it's all interconnected.
Very much so in cats. You really have to look at the whole picture. Other causes in cats can be tumors, strictures, parasites again, or even things like diaphragmatic hernias.
So if this blockage is happening, what signs should someone look for? What are the red flags?
The classic sign really is jaundice. That yellowing of the skin, eyes, gums.
Caused by the bilirubin buildup we talked about.
Exactly. You might also see really dark urine because the kidneys are trying to filter out that excess bilirubin. And conversely, pale clay-colored stools because the bilirubin isn't making it into the gut to give stool its normal color.
Okay, dark urine, pale stool, got it.
Sometimes there's intense itching pruritus, probably from bile salts under the skin. And if there's infection involved, like cholangitis, you might get pain in the upper right belly, fever, or maybe even chills.
But you said for pets it can be trickier, less obvious.
Oh, definitely. The signs in dogs and cats can be super vague initially. Things like just decreased appetite, maybe some vomiting or diarrhea, being lethargic, stuff that could point to a lot of different problems.
That sounds frustrating. Easy to miss.
It can be. And often that obvious jaundice In pets, it might only show up later when the obstruction is already quite significant or has been there a while.
So paying attention to those subtle changes early on is really key then.
Absolutely crucial. Don't wait for them to turn yellow.
Right. So let's say a vet suspects EHBO based on some of these signs. How do they confirm it? What's the diagnostic journey like?
It starts with that good physical exam, feeling for pain, checking for jaundice. Then, blood work is vital.
What are they looking for in the blood?
Key things are liver enzymes, especially one called alkaline phosphatase, or ALP, and bilirubin levels. If those are high, it's a big red flag for a bile flow problem.
So,
A complete blood count, a CBC, can also help check for signs of infection. Sometimes in human medicine, they check tumor markers too, like CA 19-9, but those aren't always specific.
and then imaging, I assume. Gotta see what's going on inside.
Imaging is absolutely essential. Ultrasound is usually the first stop.
Why ultrasound first?
It's non-invasive, readily available, and really good at showing if the common bile duct is dilated, stretched out, which suggests a blockage.
Makes sense.
It can also spot gallstones or that gallbladder mucosal sludge in dogs or other gallbladder issues.
What if the ultrasound isn't totally clear or they need more detail?
Then we move to more advanced stuff. There's MRCP, magnetic resonance cholangiopancreatography. It's an MRI specifically focused on the bile and pancreatic ducts. Very detailed, non-invasive.
Okay.
There's also EUS, endoscopic ultrasound. That involves putting a scope down the throat with an ultrasound probe on the end. Gets really close-up images.
Oh.
And with EUS, they can sometimes even take little needled biopsies of suspicious areas.
And you mentioned ERCP earlier, too.
Right, ERCP, endoscopic retrograde cholangiopancreatography. That one's a bit more involved because it's both diagnostic and therapeutic.
Meaning they can fix things at the same time.
Exactly. They use a scope, inject dye to see the ducts on X-ray, take biopsies. But they can also remove stones, stretch narrowed areas, or place little tubes called stents to keep the duct open.
Okay. And what about plain old x-rays? Do they have a role?
Sometimes. They're not great for seeing the ducts themselves, but they can sometimes show certain types of gallstones, the ones that are calcified, and they can help rule out other abdominal problems.
You used the term cholestasis before. Can you break that down?
Yeah.
And how do vets tell if the blockage is inside the liver versus outside?
Sure. Cholestasis just means bile flow is slowed or stopped. Intrahepatic means the problems inside the liver tissue itself, maybe damaged liver cells or tiny bile channels within the liver, are blocked.
Like liver disease or a reaction to a drug.
Exactly. Things like hepatitis, certain toxins, some meds. With intrahepatic cholestasis, the jaundice might be milder, pain less common. Ultrasound might look pretty normal, maybe slight duct changes. ALP might be up, but maybe not as dramatically.
Okay, so that's intrahepatic, inside the liver.
Right. Now, extrahepatic cholestasis, that's our EHBO. The blockage is in the bigger ducts outside the liver.
The main highway is blocked, not the city streets.
Perfect analogy. So with EHBO, jaundice is often more severe, gets worse. That upper right belly pain is more common. And ultrasound is key. You often see that common bile duct clearly dilated, widened. And the blood work usually shows a really significant jump in ALP and another enzyme, GGT, plus the high bilirubin. So looking at the whole picture signs, labs, ultrasound helps pinpoint where the blockage is.
That distinction seems really important for figuring out treatment.
Absolutely. It guides the whole approach.
So let's talk treatment. Once EHBO is diagnosed in a pet, what happens first?
The first absolutely critical step is stabilization and supportive care, especially if the pet is quite sick.
What does that involve?
Usually intravenous fluids, IV fluids to correct dehydration and support circulation. Medications to control vomiting, like meropetent or ondansetron.
Amymatics, right?
Yep. And pain relief is crucial. We use things like buprenorphine or hydromorphone. Importantly, we generally avoid NSAIDs, non-steroidal anti-inflammatories in these cases, as they can have side effects on the kidneys or stomach lining, which we don't need.
Makes sense. And food.
Nutritional support is important too. Start it as soon as they can tolerate it, maybe initially through fluids or a feeding tube if needed.
Okay, stabilization first. What about antibiotics? When do they come in?
Antibiotics are definitely needed if there's signs of infection, like a fever, signs of sepsis, which is a body-wide infection, or if we strongly suspect cholangitis, that bile duct infection.
And is it specific antibiotics?
Yeah, the choice depends on what bacteria we think are involved. Often it's bacteria from the gut. So combinations like ampicillin plus enrofloxacin are common for broad coverage.
Okay.
If we're worried about anaerobic bacteria, the ones that don't need oxygen, then maybe adding metronidazole or using clindamycin or a combination like amoxicillin clavulinate with metronidazole.
Got it. Now, it seems like for a lot of these causes, like stones or mucocellus,
Yeah.
you eventually need to physically deal with the blockage, right?
Yeah.
When does surgery become the plan?
Surgery is often necessary, yeah, especially if there's a definite physical obstruction like a stone or mucocella, or if the gallbladder has ruptured, or if medical management just isn't working.
What are the main goals of surgery in pets with EHBO?
Primarily, confirm what's going on, definitely restore that normal bile flow, and try to minimize any complications.
Can you walk us through some of the actual surgical procedures? It sounds like there are a few
Yeah,
options.
sure. The specific op depends on the cause. If the gallbladder ruptured, that's often from a mucosal in dogs, then it's usually a cholecystectomy.
Which means?
Complete removal of the gallbladder. That's the most common surgery for gallbladder rupture or obstructive mucocellus.
Okay. What if it hasn't ruptured, but there are stones or sludge inside?
Then options might include a cholecystotomy, cutting into the gallbladder to clean it out, or a choledochotomy, cutting into the bile duct itself to remove a stone lodged there. Though often, even for stones or mucocellus, removing the whole gallbladder, cholecystectomy, is preferred if it's diseased.
Right.
If there's a tumor, the goal is removal if possible. If there's really bad scarring, fibrosis, blocking the duct that can't be fixed, they might do a bypass procedure.
A bypass.
Yeah, like a colodacoduodenostomy. They create a new opening, connecting the bile duct directly to the small intestine, bypassing the blocked segment.
That sounds complex.
It is a significant surgery. There are also terms like cholecystostomy tube, that's a temporary drain placed in the gallbladder, or a biliary enteric anastomosis, which is a more general term for surgically connecting the biliary system to the intestine for drainage.
Okay. And stents, you mentioned those with ERCP. Could they be placed surgically too?
Yes, sometimes colodocal stents are placed surgically to keep a duct open, and minimally invasive surgery like laparoscopic cholecystectomy is becoming more common too. Small incisions, faster recovery sometimes.
How does this compare to human treatment? Is ERCP the main thing for people?
For benign causes in humans, like gallstones in the duct, yes, ERCP is often the first line. They can often fix the problem without open surgery. Surgery is more for when EOCP doesn't work or isn't possible.
And for malignant cancerous blockages?
That's tougher. If surgery to remove the tumor is possible, that's the goal, but often it's not. Then it's about palliation, relieving the blockage with stents placed via ERCP or sometimes surgically to improve quality of life. Chemo and radiation might also be used.
You mentioned cholangitis a few times, that infection. How is that managed specifically?
That needs quick action. Prompt, strong antibiotics are key. And biliary drainage is crucial, getting that infected bile flowing out. That drainage is usually done via ERCP or sometimes percutaneously, meaning a drain placed through the skin into the bile ducts using imaging guidance.
Okay. Are there any other really important points for managing EHBO in pets that we should highlight?
Definitely. A couple big ones. Because fat absorption is messed up, absorption of fat-soluble vitamins like vitamin K can be poor. Vitamin K is needed for blood clotting.
So they might have bleeding problems.
Exactly. So vets often give vitamin K injections, usually under the skin, to prevent or treat clotting issues, especially before any surgery.
Good point. Anything else?
Yes, liver support medications, hepatoprotectants, or antioxidants like Cyzyme or milk thistle derivatives are often used.
Okay.
And a huge warning, do not use ursodiol if you know or suspect there's a complete obstruction.
Why not? I thought that helped with bile.
It increases bile flow, which sounds good, but if the exit is blocked, you're just increasing pressure behind the blockage. It could potentially make things worse, maybe even cause a rupture. So no ursodiol in confirmed obstruction.
Okay. Crucial point.
And remember, the triaditis in cats need to manage the pancreatitis in IBD too.
Oh, and one more thing for dogs. They seem to be at higher risk for acute kidney injury with biliary obstruction, possibly due to toxins from bacteria getting into the bloodstream. Something to monitor closely.
Wow, lots to consider. Let's shift to some really critical concepts. You mentioned Charcot's triad and Reynolds' pentad earlier. Can you explain those again and why they're such a big deal? Right, these are classic signs, mostly from human medicine, but relevant conceptually. Charcot's triad is 3 things pointing strongly to cholangitis, that bile duct infection. It's jaundice, fever, and right upper quadrant abdominal pain.
Okay, the triad: jaundice, fever, pain.
Exactly. Now, Reynolds pentad is Charcot's triad plus 2 more signs, indicating things have gotten much worse, likely septic shock from the infection.
Septic shock.
Yep.
Okay, what are the 2 extra signs?
Altered mental status confusion, lethargy, decreased responsiveness, and hypotension, which is low blood pressure, shock.
So Reynolds pentad is jaundice, fever, pain, confusion, and low blood pressure.
Correct. Seeing that pattern is a huge red flag. It screams severe, life-threatening infection needing immediate, aggressive treatment, a true emergency.
Got it. Another scary term was bile peritonitis. What is that?
That's when bile leaks out of the biliary system, the gallbladder, or bile ducts into the abdominal cavity.
Leaking bile. That sounds bad.
It is. Bile is really irritating to the peritoneum, the lining of the abdomen. It causes severe inflammation, peritonitis.
What causes the leak?
In pets, especially dogs, the most common surgical emergency leading to this is a ruptured gallbladder mucocele. But trauma or other duct issues could also cause it.
How would a vet know it's bile in the abdomen?
Well, if they drain fluid from the abdomen, it often looks yellow or greenish. And crucially, if they test that fluid, the bilirubin level in the fluid will be much higher, typically more than twice as high as the bilirubin level in the blood.
And that's an emergency too.
Absolutely. Bile peritonitis requires urgent surgery to find the leak, fix it if possible, often by removing the gallbladder, and thoroughly flush out the abdomen. It can rapidly lead to sepsis.
Okay, definitely critical stuff. For any vet students or vets studying for exams like the NAVLE, what are the absolute must-knows about EHBO?
Definitely know Charcot's triad and Reynolds pentad and what they signify. Be really clear on differentiating intrahepatic versus extrahepatic cholestasis, the signs, the typical lab patterns, the imaging findings like duct dilation for EHBO, and understand the indications for ERCP when it's used, and be aware of its main potential complications, especially pancreatitis.
Great summary. To make this even more concrete, let's quickly run through those NAVLE-style questions you prepared. How would these concepts apply?
Okay, sounds good. First scenario. A lab comes in, increasingly yellow, vomiting, painful in the upper right belly, has a fever. What finding most strongly suggests EHBO?
Based on what we said, the dilated duct.
Exactly. Dilation of the common bile duct on ultrasound is the key finding there, pointing specifically to an extrahepatic blockage. Elevated liver enzymes like ALT tell you the liver's upset, but not where the problem is.
Right. Okay, next. A dog with suspected EHBO, jaundice, fever, but now also seems confused and mentally dull. What does that suggest?
That cluster of signs, jaundice, fever, altered mental status, especially if you assume pain and maybe check blood pressure, that points directly towards Reynolds pentad.
Indicating severe septic cholangitis.
Precisely. A medical emergency.
Okay, what about a cat? Yellow gums, poor appetite. Ultrasound shows a thick gallbladder wall, dilated bile duct, and changes suggesting pancreatitis and intestinal inflammation.
That whole picture screams cholangitis with triaditis causing a secondary EHBO. It's that classic interconnected inflammation in cats.
Makes sense. Antibiotic choice for a severe biliary infection while waiting for culture results.
You need broad coverage. So a combination like enrofloxacin and ampicillin is a good empirical choice, hitting likely gram-negatives, gram-positives, and some anaerobes.
Okay. What if the dog isn't responding to medical treatment and ultrasound then shows the gallbladder has ruptured with bile in the abdomen? What's the immediate next step?
No question. Emergency exploratory surgery for cholecystectomy. Got to stop the leak and clean out the abdomen ASAP. It's life-threatening.
Right. And a potential complication after an ERCP procedure.
The most common one to watch out for is pancreatitis. The procedure itself can irritate the pancreas.
Good to know. Last one. What factor is most strongly linked with a poor outcome in dogs treated for EHBO?
The development of septic bile peritonitis. A rupture leading to widespread infection in the abdomen carries a very guarded prognosis, much more so than just high bilirubin or response to fluids.
Okay, that really helps illustrate the practical side. So let's try and boil this all down. What are the absolute key messages you want people listening to take away from this deep dive on EHBO?
I think the main things are EHBO is serious. It's about bile flow being blocked outside the liver. Jaundice is a key sign, but watch for subtler things too, especially in pets.
Right, don't wait for the yellow.
Exactly. Imaging, particularly ultrasound, is crucial for diagnosis. And treatment really depends on the cause, ranging from supportive care and meds right up to major surgery. Early recognition and action are vital.
And for you, our listener, why does understanding something like EHBO matter?
Well, I think it really shows how incredibly complex and interconnected our pets' bodies are, doesn't it?
Yeah, definitely.
And it highlights why noticing those small changes and getting prompt veterinary care is so important. Plus, it's pretty amazing to see the kinds of diagnostics and treatments that are possible now.
Absolutely. So, to leave you with something to think about, given that so many different things, stones, inflammation, sludge, even cancer, can all lead to this same endpoint of a blocked bile duct, what does that really tell us about how problems in one area, say the pancreas or gallbladder, can cascade and impact the whole digestive system? And maybe flip that around, what other seemingly vague symptoms might actually be linked back to core issues with digestion or bile flow.
That's a great point. And maybe also think about how these advancing imaging techniques we talked about, like detailed ultrasound or MRCP, how might they change how we diagnose and treat not just EHBO, but other kinds of internal obstructions or problems in the future for both us and our animals?
Definitely some interesting food for thought there.